Hi, my name is Alan Porter. I'm the CEO of Strategic Wealth Strategies. Also, I'm a certified financial fiduciary, a certified tax and business advisor, and a tax strategist. I want to go into an area today that affects every business owner and their employees, from not only their bottom line, but the quality of life. My family has been affected with poor health for almost a decade and a half. My son is 100% disabled with diabetes and the disease or illness they cannot figure out a cure for, and it's been going on for 17 years. His wife died of pancreatic cancer at age 39. My daughter, who gave birth to my third grandson, was diagnosed with breast cancer, and we didn't think that she was going to live. Thank God, it's been over a decade so far, but she's also been diagnosed with grave disease and thyroid eye condition. Her latest treatment was in 2023 with only one drug that they had at the time called Trapeza, which was 8 injections, the first one costing $32,000, and the last one in May of 2023 had cost almost $250,000. The problem is that in January of 1994, the thyroid eye condition came back. In February, her doctor told her, "Nicole, there is nothing we can do until you go blind, and then we can operate." They tried to get her in a study at Duke University, but she didn't qualify because she had already taken the trapezum, but managed to get her into the Mayo Clinic in Rochester, Minnesota, where she went for 4 days of consultations and testing. But there's nothing that they can do. They had one drug that may be 50% effective. They don't know, but it was even more expensive than the Trapeza. She's living day to day in misery. My point in telling you my personal story is maybe something can be done if people implement preventative health and wellness programs. I promote one now that I think is outstanding. It has many benefits. There is no net cost to the employer and no net cost to the employee. Very few people know about these programs, but they've been around for decades. Did you realize that for every $1 spent on wellness programs, companies save $3.27 in healthcare costs? That's by the Harvard Business Review. What is every business owner concerned about? Number one, revenue. Number two, recruiting. Number three, retention of qualified individuals. I want to share some other facts with you that as a business owner, it should be a great concern for you. This is the prescription drug spending in employer health plans 2024. Growth in spending. Pharmacy benefit costs rose by 7.7% in 2024, following an 8.4% increase in 2023. This marks prescription drugs as the fastest growing component of employer health benefit expenses. Prescription drugs accounted for 27% of total healthcare spending in employer-sponsored plans in 2023, up from 21% in 2021. This significant rise is attributed to factors such as the introduction of high-cost specialty therapies and increased demand for medications like GLP-1s used for diabetes and obesity treatment. The average per-employee cost for employer-sponsored health insurance reached $16,501 in 2024, representing a 5% increase from the previous year. These figures highlight the growing financial impact of prescription drugs on employer health plans, underscoring the need for strategic cost management and benefit design to address rising healthcare expenditures. The economic impact of poor health among employees costs U.S. employers an estimated $575 billion annually in lost productivity. What about lost workdays? Employees miss approximately 978 million days of work each year due to illness. An additional 540 million days are lost annually when employees are at work but not fully productive due to health issues. Total cost. This sums up to 1.5 billion days of lost productivity each year. Per employee cost, on average, absenteeism and presenteeism cost employers $2,945 annually per salaried employee. Verified by Investopedia. What are some of the benefits of a preventative health and wellness program? Number one for employers is a savings of between $500 to $700 a year in FICA tax savings. This alone can be hundreds of thousands, if not millions of dollars of savings that affects the bottom line of the company. Number two, People with this preventative health and wellness program have an 8% higher production rate and a 7% higher retention rate. As you can see, the employer benefits from an increase in revenue from tax savings and an increase in production, but it also helps to mitigate problems in recruitment and retention. If you are a business owner, I want you to think about that. All those benefits for no net cost to you or your employees is a win-win situation for everyone. What are the benefits for the employees? As I said, it is no net cost to them. Number one, they will have a health and wellness app with one login for the entire family. You have unlimited telehealth benefits, which cover virtual telemedicine. Do you realize that 50% to 70% of all visits to the emergency room or a doctor's office can be handled through telemedicine? People just need to understand what is wrong with you, so qualified medical personnel can't prescribe a prescription for you. This is for primary care, urgent care, behavioral health, dermatology, and again at $0 copay. There are personalized programs from chronic disease management. Understand this. Over 60% of Americans have some sought type of chronic disease. Prescription assistance program, annual vital lab test at no cost, health risk assessments, weight management programs, virtual pet care, a fitness and nutrition library, financial fitness programs, health education programs. It's care for the entire family. This program focuses on predictive and preventative health care before it becomes an acute need or serious condition, which will reduce payroll cost. Prioritizing preventative health and wellness with an enhanced comprehensive pre-tax health management program. And there's no disruption or replace any medical plan, prescription drug, or supplemental benefits. It is just a fantastic benefit at no net cost. It has a biometric facial scanner that measures pulse, heart rate variability, breathing rate, systolic blood pressure, diastolic blood pressure, stress index, parasympathetic activity, cardiac workload, and others. We have a fitness and nutrition library with comprehensive resources, customizable plans, anytime, anywhere. It also has life guides from Healthy Body, military service and veterans, emotional well-being, how to cope with illness, caring for caregivers, home life and relationships, and many others. You can connect from home, work, or wherever life takes you. Number two, they will average around $100 extra in their paycheck every month through tax savings. And this is very important to understand the tri-agency ruling from the IRS, the Employee Benefit Security Administration, and the Health and Human Services Department stated on April 4th of 2024 that these funds do not have to be used for medical purposes. They can be used by the employee for non-medical purposes such as gas and groceries to pay rent or mortgages. Very few people know this. Number three, there is a hospital indemnity program that is broken down into 6 areas of pay, from $600 to $1,500. I will concentrate on the $1,200 plan. If you're in the hospital for 1 day, you are paid $1,000. If you're in the hospital for 30 days, they write a check to you for $3,000. If you go to the emergency room for an injury, for sickness, they will write you a check for $150. And if you must use an ambulance, they will write you a check for $250. But the big thing is they will pay you a claim payment of $1,010. And this happens every month in your paycheck. Number four, they have a prescription program with over 1,100 prescriptions at $0 copay that does not affect the prescription program if you have healthcare coverage. In fact, you don't even have to have healthcare coverage, and the digital RX card is accepted at 70,000 pharmacies across America. Number five, a comprehensive diabetes program with a free meter, low-cost testing strips, lancets, and more. They even have the diabetic drug metformin at $0 copay. Number six, they have a prescription assistance program for any medication over $200. As an example, one employee had a child that was prescribed a medication that cost $720 a month with a $5,000 deductible. That's a financial burden for anyone because of this program that was reduced to $166 a month. Number seven, they even have a program that is available for your pets that is available 24/7 365 days a year. Skip the trip to the veterinarian with a virtual pet consultation. This may save hundreds, if not thousands of dollars by itself. Did you realize that major health insurers under legal scrutiny? Number one, Blue Cross Blue Shield. BCBS agreed to a $2.8 billion settlement to resolve claims from healthcare providers, alleging that BCBS entities conspired to divide markets and suppress reimbursement rates. This settlement, one of the largest in healthcare antitrust history, includes operational changes to prevent future litigation. Several major health systems, including those in Philadelphia, opted out of the 2024 settlement and filed separate antitrust lawsuits. They allege that BCBS's territorial agreements limited competition and led to underpayments to providers. A Louisiana jury awarded $421 million to a hospital after finding that BCBS of Louisiana underpaid insurance claims for over a decade. Anthem BCBS of New York faces a class action lawsuit alleging it misrepresented its provider directory, leading patients to believe certain doctors were in network when they were not, causing financial and care access issues. Number two, Aetna, CVS Health. The U.S. Department of Justice sued Aetna, among others, alleging they paid illegal kickbacks to brokers to steer Medicare Advantage enrollees, avoiding those who were disabled or costly to insure. Verified by the Wall Street Journal. Aetna is being sued by transgender women who claim the insurer unlawfully denied coverage for facial feminization surgeries by labeling them as cosmetic, violating anti-discrimination provisions of the Affordable Care Act. Number three, Cigna and Express Scripts, PBM subsidiary. The pharmacy benefits manager, the middleman. Cigna's PBM, Express Scripts, is among those sued by the FTC in several states for allegedly inflating insulin prices through rebate schemes that favored higher-priced drugs, increasing costs for patients. Unsorry. This is very important to understand. Pharmacy benefit managers, PBMs, are under fire. PBMs, acting as intermediaries between insurers and drug manufacturers, have significant influence over drug pricing and access. The FTC sued the three largest PBMs, OptumRx, CaremarkRx, and Express Scripts, alleging they manipulated the rebate system to favor higher-priced insulin products, driving up costs for consumers. States like Vermont and Utah have filed lawsuits against PBMs and insulin manufacturers, accusing them of conspiring to inflate insulin prices by up to 1,000% over the past decade. A bipartisan coalition of 39 state attorneys general has urged Congress to enact legislation increasing transparency and regulating PBM practices to prevent unjustifiable drug price increases. Unsorry. What are the implications for healthcare costs? These lawsuits highlight systemic issues. Antitrust cases against BCBS reveal how market division and lack of competition can lead to suppressed provider payments and higher consumer costs. Legal actions against PBMs expose how non-transparent rebate and pricing strategies can inflate drug costs, particularly for essential medications like insulin. Lawsuits against insurers like Aetna underscore concerns about equitable access to necessary medical procedures affecting marginalized communities. The program I support has been legally vetted, been in business for over 50 years, and handles the insurance offerings of over 500,000 people. This program is compliant with Section 125 of the IRS Code and have deep knowledge of tax codes 105, 106, 213D, so all elements are compliant. It is also compliant with the Affordable Care Act as amended through May 1st, 2010. An average of 94% of employees qualify for this program. So if you are a business owner, I'm going to ask you some questions. Number one, does this sound like something that your employees would want? Number two, if all the benefits I pointed out to you at no net cost to you or your employees, would you do this program? You have everything to gain and nothing to lose. Number three, Do you have a healthcare program? You don't have to have this preventative health and wellness program. It is just an added benefit for you to add revenue, increase production, and retain qualified individuals. Number four, if you do have a healthcare program, do you realize that you're being overcharged 20 to 30%? What is your relationship with your healthcare provider and the PBM, Pharmacy Benefit Manager? Number five, if you do have a healthcare program, would you like to save from 20 to 40% of your healthcare cost because of the zero cost copay of 1,100 prescriptions? Again, saving you money by reducing your healthcare costs that go up every year. How much does prescription cost a healthcare plan per year? In 2023, it was approximately $714 billion, and again goes up every year. There are many other things that I can help a business owner with to include a new healthcare plan that will save him or her money over their present plan. Not only that, I can possibly set up a tax-free retirement plan for the employer from the savings of the taxes from the Preventative Health and Wellness program. Understand this tax-free retirement program grows tax deferred. Your distributions are tax-free. It avoids probate. It is protected from lawsuits, liens, and judgments. It is the greatest wealth transfer vehicle available. I could show you how to become your own bank, borrowing from yourself and paying yourself compound interest that you are paying financial institutions and eliminating the effective interest cost on the money that you borrow. Not only that, it will eliminate or mitigate the risk in retirement, such as sequence returns risk, which very few people know about. The number one fear in retirement, running out of money before you run out of life, market risk, tax risk, government risk, and longevity risk, which is a risk multiplier. It also does not affect the taxation of Social Security or the means testing for Medicare Part B, which can go up by over 350%. It will provide you with long-term care cost for pennies on the dollar that is tax-free. Many people do not understand, nor are they prepared for the cost of long-term care that right now is $50,000 to $200,000 a year. And if you are not prepared for long-term care, there is something that may destroy your retirement for you and your spouse. It's called Medicaid spend down, because Medicare does not pay for long-term care. Medicaid does. The caregiver will be the one that will hurt the most because all your assets will be spent to pay the long-term care cost of the affected person, and the caregiver will be left with, I think, $137,000, one car, one house, and a small subsistence, even if you had millions of dollars in your portfolio. There are many other things that I help my clients with, from college planning and funding, tax planning and saving, asset protection, legacy planning, and charitable gifting, saving healthcare costs and providing benefits that the vast majority know nothing about, and that include CPAs, attorneys, and financial planners. I teach my clients to think outside the box of conventional financial planning and provide education in all these areas. I have a team of people that I work with that are specialists. And what do I mean by that? Let's say that I'm your medical doctor. I can treat you for minor illnesses and injuries, but if you want your knee operated on, you want an orthopedic surgeon to do that, the specialist. And that's what I have on my team. You, on the other hand, may not have the specialist, only the treatment of your family doctor. I have tax-specific attorneys and CPAs and other specialists in their fields, and we collaborate to provide solutions for people's financial problems. Again, I teach people to think outside the box of conventional financial planning, to educate them on the financial strategies the wealthy and financial institutions have been using for years to possibly reduce or eliminate both debt and taxes. As I said before, possibly set up a tax-free retirement, become their own bank, eliminate the risk and retirement that a stock portfolio only compounds, and help with the extreme cost of healthcare. My name is Alan Porter, and you can reach me at 910-551-1046. My email is strategicwealth0@gmail.com, and you can always set up an appointment on my website at www.strategicwealthstrategies.com. I do not charge a fee for my consultations. I want to educate people on financial strategies that should be taught in high school and especially college. Time is money, so let's get together soon to secure your financial future. I want to thank you for watching my presentation and hopefully learn some valuable information.